gonna go ahead and get started. Hopefully everybody can hear me and see our shared screen here. So I just wanted to say hello and thank you to everyone who took the time to join this important discussion about ADHD diagnosis and medication in America's youth. And we're also going to discuss some alternative interventions. I want to start by introducing my group, Fuel for Focus. So we are a cohort of graduate students at Georgetown University. We're passionate about public health and health advocacy. So we started this group dedicated to encouraging drug-free interventions for youth diagnosed with a learning disorder, such as ADHD. So we really became inspired to start this advocacy group after doing important research in the Washington, D.C. area. And we found within the DMV, which is our surrounding area, that there are higher rates of ADHD diagnosis and also higher rates than any other states of patients prescribed stimulant medication as a treatment to ADHD diagnosis. I would say many of us know someone who has struggled with ADHD symptoms. We may be struggling with them ourselves. And many of these diagnoses can come at a young age, such as kindergarten or even way before. It is also likely that this understanding of the best treatment is medication. So we decided to explore the possibility of implementing consistent before, during, and after school activity for elementary school age children, which is the time that ADHD diagnoses are most common. It's something that children already love to do, and it turns out that exercising is the best thing, to dedicate to ensure that it's better for teachers, parents, and students alike. We discovered that more physical activity would not only improve the focus and intellectual abilities of children, but also reduce the negative consequences for those who have trouble paying attention in class. We have been fortunate enough as a group to work with Kathleen Tully, a panelist here today, and the CEO of Active Kids and Minds, who can attest to these positive outcomes for kids who have ADHD symptoms. We hope to have a discussion today about the safety of these drug prescriptions and the necessity of an ADHD diagnosis. Additionally, we're going to discuss brain health benefits and alternative interventions, including regular exercise for children throughout the school day. We're fortunate enough today to have three wonderful panelists to speak on these topics from their unique perspectives. Throughout the discussion, if viewers have any questions or comments, please feel free to leave them in the question and answer tab in the bottom, and we will answer them and have our panelists address them after everyone has spoken. Thank you so much. So it is my pleasure to introduce these panelists. Today, we're going to have Dr. Gretchen Lefevre-Watson. She is a licensed clinical psychologist. We also have Adrian Quevedo, who is the founder and CEO of Neurologics. And we have Kathleen Tully, who is the founder and CEO of Active Kids and Minds. Without further ado, Dr. Lefevre-Watson, if you want to take over. And thank you all so much. You're muted.
So are my slides showing okay?
Yes.
Okay.
Thank you.
So I think my setup is really why we need the work of the other panelists. So I'll try to go through this pretty quickly, but of course can take questions at the end. What I'm going to give you is a little bit of historical perspective on ADHD medication treatment trends, going back to the 1960s when the American Medical Association first sanctioned the use of stimulants for treating MBD, minimal brain dysfunction, or what we now call ADHD. And from 1960 to about 1970, there was a six-fold increase in the use of stimulants. And this prompted a developmental psychologist, Alan Sroufe, who you see depicted here, and a psychiatrist, to publish an article in the New England Journal of Medicine saying that they were concerned about this increase in drugs for three main reasons. One, they thought it might reduce parent and teacher motivation to try other interventions. Two, there could be inadequate monitoring of drug prescriptions. And three, the use of these drugs might ultimately lead to drug addiction. Well, that early warning turned out to be very prescient, but very much ignored because ADHD prescriptions continued to uptick through the 70s and 80s. And then in 1980, when the American Psychiatric Association officially added it to its new diagnostic manual, the DSM-3, we saw very dramatic increases in ADHD. And they took off again after 1991 when education laws changed. The IDEA legislation came into effect that effectively made ADHD recognized it as a disability for which children could get special education and school accommodations. And so during the 1990s alone, we saw a 700% increase in the use of stimulant drugs in this country. And by the end of that decade, we were consuming somewhere between 80 to 90% of the world's supply of the drug. During this time, even though drug use for ADHD increased so substantially, and there were lots of warning calls, this was very much ignored, and the pharmaceutical industry aggressively marketed further use of the drugs. And they had a lot of academic experts around who were helping them with this, including Larry Silver, a psychiatrist who was and may still be associated with Georgetown University, and at one point was a National Institutes of Mental Health director. And he ghost wrote this ADHD information pamphlet that you see here. Novartis, a ADHD drug manufacturer, actually produced it, and then he put his name on it. And then drug representatives went around the country giving these pamphlets out for free to school divisions, and then schools handed them out to teachers and parents. And there was one version for parents and one version for teachers. And I'm just going to read you a little bit of what was on the inside, which was very much marketing that was not, as we now know, true. It says, these medications do not cure ADHD. Instead, they appear to work by correcting for a lack of certain necessary brain chemicals in the nervous system. Parents should be aware that these medicines do not, quote unquote, drug or, quote unquote, alter the brain of the child. They make the child, quote unquote, normal by correcting for a neurochemical imbalance. It goes on to talk about drug holidays and that some doctors will take the children off the medication on weekends or over holidays, and that really isn't necessary according to this drug pamphlet. So then that helped. And again, if we look at the rising rates of stimulant use, again, in the next set of years, this graph showing you from 2000 all the way up to 2024, you can see that there were continued upticks up until about 2018, when there were a lot more warnings by the FDA and the DEA. And most recently, the DEA has required that every stimulant have a new boxed warning on it that is more explicit about the fact that these drugs are indeed addictive and very prone to abuse. As these rates were rising for a long time, prominent ADHD experts who were extensively funded by the pharmaceutical industry kept on sending out the message through media and other outlets and training courses and journal articles saying, ADHD overdiagnosis is not the problem, it's the underdiagnosis. But in 2013, Keith Connors, the clinical psychologist who's often dubbed the father of ADHD, finally, if you will, confessed to the other leading ADHD experts from around the world that gathered annually or about annually to talk about what was going on in the field. And he was at Harvard just looking at the effects of methylphenidate on behavior in brain damaged children when the drug company approached him and said, hey, if we could take your research instrument and turn it into a checklist, this would be great. And it became what we now know as a Connors Behavioral Rating Scale, which is the most commonly used ADHD checklist. And in 2013, Connors went public and said that what we were looking at with the rate of ADHD diagnosis and treatment represented a false epidemic. He said that the diagnosis, which he helped create, was really a concoction to justify giving out of medication to at unprecedented levels. And he said what we had created was a national disaster of dangerous proportions. Now, why would someone who was at the forefront of pressing for more children to be identified and medicated for decades suddenly start to have these concerns? Well, some of the reasons were that it was becoming more public that the use of these drugs um, was more dangerous than a lot of the ADHD experts were telling us. There was very clear indication that the drugs were being diverted, they were being misused, they were being abused, and more youth in drug rehab centers were talking about their ADHD prescriptions kind of opening up the door to their drug abuse, which often ended in opioid and abuse and meth abuse and the like. And so Connor just actually went and visited one of these rehab centers and really had a felt a need to change the narrative. And one of the things that is tricky about ADHD in this country in particular is that we think of ADHD and we think of psychostimulants, but psychostimulants really can often lead to a prescribing cascade. That's where you start taking one medication, let's say Adderall for ADHD, but over time, the most people with psychotropic drugs will begin to experience more of the negative or adverse effects of the drug and less of the beneficial effects of the drug. So at first, stimulants might have a positive effect. They do for most people, whether or not you have ADHD. And then over time, you need more and more of the drug, and then you reach your maximum dosage level that you can take. So it's common for doctors to add other drugs and start adding and switching and mixing drugs. The next type of drug that's usually added is an antidepressant. And then you've got children on or youth on stimulants and antidepressants, and you're having moods go up and down, and mood stabilizers get added, and eventually antipsychotics. And that sounds extreme, but it's becoming more normative than you might think, where we now have 40% of 2 to 24-year-olds in this country taking multiple types of psychotropics to treat ADHD. And in one study, ADHD was implicated in a quarter of antipsychotic adverse events. This study, this New York Times report that would be really interesting to go look at if this is a topic of interest to you. The journalist Matt Richtel did a really good job of exposing how this prescribing cascade takes place, and you can see this young woman, a teenager, Renee Smith, was on 10 drugs, different psychotropics, before she graduated from high school. In elementary school, she got diagnosed with ADHD. Stimulants worked for a while. Then the antidepressant got added, one and then another, and then mixtures. And you can see then there were mood stabilizers and antipsychotics, just as I described. We're also hearing a lot about more and more emergency room visits that are specific to ADHD medications. And one of the responses to this nationally has been, oh my goodness, we have all these children and youth showing up in hospital emergency departments with psychiatric emergencies, and your normal emergency room is really not equipped to handle those kinds of situations. So in several places, including where I live, the response has been, we need more child psychiatrists and we need to build pediatric specific psychiatric hospitals. So my community at the end of 2022 opened a 14-story psychiatric hospital just for children. But an emergency room doctor from this area said, the problem is these children who are coming in to emergency rooms for psychiatric crises are already on what he calls a book of drugs. And many of them have already gone from ADHD diagnoses to bipolar diagnoses and are on antipsychotics. So one of the questions is, do we really need more child psychiatrists and more nurse practitioners who can prescribe these drugs, or do we need to start dialing back the use of those drugs? So that's kind of the setup that I think will hopefully generate some discussion about why we need alternatives to medication for dealing with ADHD related behaviors.
Thank you so much. That was great. Thank you.
Mhm.
Right, Adrian, you're going to be next if you had a slide to share or if you just wanted to begin your presentation.
Yeah, so I can jump in. I've got a couple slides that I do want to show, but first of all, thank you, Kyla, for giving me the opportunity to talk about something that I'm very dear and something very dear and near to me, which is working with families and kids that have had that diagnosis of ADHD. And to kind of echo and just repeat a lot of what Dr. Gretchen said is that a lot of the kids that I've come across in the 26 years of doing what I do, my background's in clinical psychology, my graduate and undergraduate degrees are just in that. And as I started as a therapist, I saw that there was just this emerging amount of diagnostic criteria that was being added to the statistics manuals that we use for diagnostics. And then came in the onset of all the spectrum disorders, and then we just started clustering symptoms together. And at that time, I had been studying about brain mapping, quantitative EEG and brain mapping and neurofeedback. And what I discovered pretty quickly was that the symptomology was not necessarily matching up with the metabolic functions of the brain that we were seeing in the EEG scans, from the perspective that you could get to an ADD diagnosis by whether or not somebody had auditory visual processing problems, tone sequencing problems, language and speech interpretation, even visual processing were things that we were seeing, that we had this immense amount of people that were being prescribed these very strong stimulant medications that didn't meet the criteria that we typically see in a brain map image for a classically diagnosed child with ADHD or ADD, which we know is in big part affected by the frontal and prefrontal cortex in the brain. So my background in my field kind of took me into the understanding the studies that were developed by Dr. Joel Lubar at the University of Tennessee, spent 20 years studying QEEG and ADHD in children. And what was really brought to the foreground was that the overprescription of these medications they weren't working as well as was once believed, because of the fact that you had kids that were being prescribed the medication that didn't have the prefrontal, whether it's the prefrontal dorsal lateral circuits or things that were typically trying to get stimulation going in those areas to increase the filtration system in the brain. And through all of the neurophysiology journals and just kind of going through the steps of understanding how attention is processed in the brain, is that we have this default mode network that we've discovered hasn't been really and since neuroimaging has figured out where these areas of the brain are. There's roughly 7 to 8 different hubs in the brain that are what are called the default mode network, and this is really our information collection area. And what was understood from there is that all that information goes into a system in the brain called the salience network. And the job of that network was to filter out salient information, or keep salient information in, and block out all of the other information that wasn't necessarily appropriate for the task at hand. And then from there, that information was percolating up into the executive networks. And what we found was that there were children that were being prescribed medication that were not responding to the medication. And what we found was that the medications were not specifically affecting the areas that were being assessed from the neuroimaging reports and studies, but were having an overall effect to where these kids were losing their personalities. They were basically, I can't tell how many times I've had a parent tell me that their child became a zombie after they were put on this medication. And so imagine, you're a neurotypical, individual that doesn't need the medication, and you're put on this medication. There's going to be personality changes, awareness changes, the focus of all these different factors that we see in a child in a classroom just become altered by the medication. So we were asked to look at what exactly was going on. And I'll share this slide here to kind of cover it a little bit, and doesn't really give it a full picture of what it is. But the understanding now is that these executive networks, let me go into, can you guys see the slides okay? Okay. So in this bottom row here, it's backwards, but in the bottom row, you see that this delta information, which is excessive slow frequency activity in the brain, is just globalized in throughout the entire spectrum of the activity. And then you have what we typically see in most ADHD or ADD diagnostics is that this frontal lobe is producing this 4 to 7 hertz frequency, which normally the 4 to 7 hertz frequency is beneficial to a human brain because it's our search engine. The brain goes out and switches from thought to thought, or different segments of attention or selective and sustained attention are dictated by increases in theta as the brain searches through the memory centers, and then that gets allocated into the frontal lobes for execution. So what was discovered was that these frontal lobes, if you had an excessive high amount of theta in the front, that was a very typical classic diagnostic criteria that was met for kids that were on that ADHD spectrum. But then we started seeing that the kids that were coming in that were being medicated, the top row is from an ADHD child that's medicated. So what we started seeing and was evident by a lot of the data that was coming forth was that it did have a globalized reduction in effect in the overall delta activity, which is slow wave frequency activity, but the theta activity was still staying there. And so we weren't really seeing, the actual benefits of the ADHD medication. And then further studies just kept compiling throughout the years. And next thing we know, we have studies that are coming out on the ability and looking at both neurofeedback and stimulant medication and seeing that there was alternatives to medication. And these studies are part of a 16 study meta-analysis that shows that, the overprescription of medication, but not only that, but that there are alternatives like exercise, like diet and nutrition, and like neurofeedback as alternatives that had an equal effect. So in some cases, in some studies, based on the TOVA studies, which are these tests of variables of attention, the neurofeedback patients had even better outcomes and results on post-TOVAs than they did pre-TOVAs than the medication group that came into the study. So what we found really is that if the brain can do the work on its own, then it doesn't need the medication to begin with. And that was a big part and proponent for a big decision-making took place with the American Academy of Pediatrics, where they started making recommendations for neurofeedback as a stage 1 intervention. And what ended up happening is that I'm not a conspiracy theory guy, but I genuinely believe that Big Pharma stepped in and they went to the American Academy of Pediatrics and told them to remove that from the website immediately because that was there for only a little while and then you can't find it anymore. And it really kind of perked it really brought my attention to its peak because at that point we had seen double-blind control studies. We'd seen a meta-analysis. We'd seen 16 studies that showed that something outperformed methylphenidate on TOVAs and different, IQ scores or just whole different range of factors that were showing that the neurofeedback was doing better. And so once that was removed, it really created an upswell in interest in people looking for alternatives to medication. Along with that, not just that, but I mean, we have a group of our medical staff, our nurse practitioners and MDs that go over the criteria and information for being put on a medication that isn't typically, talked about with the pediatrician. Now, I myself, I'm not a doctor, so I'm not licensed to treat or anything. So I leave that to the medical doctors, but I hear the conversations and saying, look, if we're going to decide to get on this drug, we're going to have to do regular cardiac, liver enzymes, growth trajectory. All these different things can significantly change in your child if this is the route that you want to take. And I was surprised to hear a medical doctor saying that because you typically didn't hear that in the patient rooms, that all of these drug warnings were not being specifically told to the parents and the families. So our doctors do it because we want the families to be informed about that. So that study was one, but the other one that was really impactful was specifically on the use of methylphenidate. And so based on the parental reports and that, we found that there was a significant improvement in not just symptomology, but core symptoms of ADHD as described by the criteria for what those core ADHD symptoms are. So at the end of the day, my understanding of it, and in 26 years of doing this, is that we have these amazing brains that can significantly adapt and change if they're being put into the right environment. A big criteria for that is understanding the metabolic profile of somebody's makeup. We're seeing now that there's a lot of different things related to food, specifically the acknowledgement of things like foods that are fortified or that are enriched with folic acid. And we're now learning a lot more about folic acid in the media and in the news, that folic acid is a man-made nutrient. And it wasn't until around 1993, 94 that the Monsanto group convinced the US Department of Agriculture to start spraying crops with this folic acid. And the problem with that, even though it's good thought and intention, maybe, that the issue that we're finding and seeing that is that roughly 40 to 44% of the human population, both male and female, have a polymorphism or a defect to this MTHFR gene, which is the methylene tetrahydrofolate reductase gene that converts folate or could convert folic acid into methylfolate, which is its usable form. So if you're a child and you are dealing with a lot of these genetic abnormalities or defects, we'll call them, from these polymorphisms, and your pantry is loaded full of these foods that have these artificial, man-made nutrients in them, the studies are showing that these things specifically can really be very excitotoxic to the brain, but also just it can cause a lot of neuroactivity that isn't typically supposed to be there. We were talking about this before we started the presentation, and the panelists and I were discussing that I had a family that literally came in for a brain mapping assessment. We did the assessment, and we saw that there was what typically there's a diagnostic now, they call it the ring of fire for ADHD, and he qualified and had the criteria for just that. And we did the brain map, we discussed neurofeedback, and I just happened to ask the family if we could take a peek at their pantry. And we looked, and there was tons of food in there that had folic acid. We did the DNA test, and he had a double polymorphism, double expression or that the allele was expressed twice in that aspect. It was basically from both parents. And the next day they removed all the folic acid foods from the pantry. And 2 days later, they called me and said, we're not going to do the neurofeedback because ADHD is gone. And I was floored because I'm like, how is that possible? And sure enough, I started talking with colleagues in and around the functional health field and asking a lot more questions. And sure enough, that's what we found. So I had some data I wanted to present, but because of time, I don't want to jump too far into it. But the real important thing that I want to touch on here is the importance of exercise in a healthy brain. We know from the studies and hemodynamics and blood flow that a healthy brain is a brain that has excellent microcirculation. And that microcirculation only improves and increases if somebody has good cardiovascular function is a big part of it. But another big part of that is just being able to deliver nutrients to the brain. And we know that if a brain isn't active, stagnation is the new heart disease, the new, all the different things that we're seeing on stagnation come from that we're seeing so many disorders that are just being brought into the fold of understanding because of circulation. And so we know that a brain that does neurofeedback gets increased blood flow, 18 to 22% from the PET scan studies that we have, and we can see that. So exercise is one of the best ways to create that perfusion in the brain to get oxygenation and blood flow and nutrients. So that's a big part of what we talk about with our program as well too. So I think that's kind of the gist of what I wanted to talk about, and just really, congratulate Kyla for stepping into this role and doing that and bringing these panelists together. It sounds like I'm so interested in their work now. I want to learn more about them. So I'm interested. I'm glad that I get to be a part of it. I hope I can contribute more down the road.
Thank you so much. We really appreciate it. Hopefully I'm going to hand it over to you. Kathleen, you're muted, just so you know.
Thank you. I just want to say how impressed I am with your whole group. Through this whole few months, you guys have really been professional and detailed and passionate. And I just appreciate working with you. So, oops, that's not what I wanted. Hold on one second. Sorry.
Let's
I'm going to share.
So much. You have been awesome as well. Everyone here has been so kind for letting us use them essentially, but not really.
Yeah, so I mean, everything that Gretchen and Adrian spoke about, like, it's just more evidence as to the importance of exercise. And I do not have any medical experience or training. I I'm just a mom that's passionate about exercise, and I was actually in corporate finance for many years, left because I had a cancer diagnosis and came across, I was going to be a stay-at-home mom, which lasted like 2 weeks. And I came across Dr. Rady's book. Dr. Rady is a professor of psychiatry at Harvard Medical School, and he talks about the profound impact that exercise has on all of us. And he followed a group of students, I think it was 19,000 kids at Naperville, Illinois, that they instituted 0-hour PE. And in his book Spark, he shows the effect that before school physical activity had on kids. They were doing better in school. They were happier. They were healthier. They surpassed Singapore in math and science. And so at that time, I had kids in elementary school, and I had a bunch of kids on my front lawn playing around before school. And I said, geez, not only do we have an obesity epidemic in this country, but we also have a mental health crisis. And this is before the iPhones came out and social media came out, but you know, the problem was brewing then. And so I went to my kid's principal and I said, can we start a before school physical activity program? And I had a bunch of moms and dads interested too. She was hesitant because, you know, teachers are overworked and they don't have enough time in the day. We went to the superintendent. He was supportive of the idea. And with the blessing of the superintendent and the principal, we started a before school physical activity program in Natick, Mass. Little did I know that it would grow into an international program, but the evidence was clear. Within 1 week, we had 80 kids sign up, and word of mom quickly spread. And that has been our reach across the globe over the last decade. So it is a free physical activity program, and we saw the need for kids to run around and play. Last year alone, we had 3,000 trainers enrolled and almost 1 million kids. We also thought that it was really important to do studies on it to prove the efficacy of the program and the impact. We were very fortunate. After about a year, Reebok came in and sponsored the program. And one of their criteria was, why don't we, you know, make sure that we're proving that this is a very important program and important for kids. And so we had Harvard and Mass General Hospital, Dalhousie, Wayne Westcott, a whole host of very well-known researchers in the field look at the impact both physically and mentally on kids. And you can find all of this research on our website, and these slides will be shared after as well. So our mission was just to make physical activity, sport, and play part of every child's day. And what we decided we needed to offer was create free curriculum that can be used before, during, or after school, and anybody can run it. Parents, community members, teachers, YMCAs, and literally make it step by step. So I'm going to go quickly through these slides, but we did everything from functional fitness to running to basketball. We do a monthly calendar where teachers can pull it up, and every day they can click on a box and it brings up a YouTube video to show the teachers what the exercise is. This is just an example of the functional fitness curriculum. As you'll see, it's 2 12-week sessions, about 400 pages, and it literally goes step by step. So somebody who's not athletic and doesn't have training can go in there and run around and play. And, you know, we see that girls drop out of sports so much. Kids only in the US, typically kids only have PE once a week. Recess is getting taken away for whether it's behavior issues or they need more time for academics. And so this is a supplement to be used. And what we found was that our program wasn't just popular in the US, that it actually, there was a demand for it in other countries. So in Canada, we had the Public Health Agency come forward with a large grant to get into 400 schools. We partnered with the Canadian Football League and the Public Health Agency of Canada to get into 400 schools. We actually got into 4,000 schools. In Indonesia, Sun Life, who was really interested in diabetes prevention, found us and came to us and had an interest in bringing the program to Indonesia. So we found a partner on the ground that could implement the program, which was World Vision. The program has been great. It's still running in both countries. And this shows you it scales around the world. It's inclusive, it's free, and it is modifiable. Right now, we're actually working with Mass General Hospital, Dr. Rachel Wooten, who's an endocrinologist. We just developed curriculum with her. She has an NIH grant, and they're looking at the impact of physical activity on prepubescent girls, polycystic ovarian syndrome specifically. And so we designed curriculum for her. And we just had Dr. Mark Fishbein from Children's Hospital Chicago Obesity Clinic reach out to us. They have over 1,000 kids on their wait list. And he said, you know, one of the things we're looking for is an exercise routine. We know that it helps these kids, whether it's mental health, ADHD, you know, community engagement. So we're designing a program for them and hope to be working with the American Heart Association and the Physical Activity Alliance to create a resource there that is a way for doctors to prescribe physical activity plans and have them on electronic healthcare records and be reimbursed. So that's just a snapshot of how we did it. Little did I know we'd ever be at this point. We were very lucky. For many years, we had Reebok's sponsorship. We no longer have that sponsorship because Reebok was sold by Adidas back in 2022. But we continue to chug along, and we have great evaluation reports and anecdotal evidence. What makes us unique is that we are truly a grassroots community-led program. So many of our programs are led by parents that find out about us and they go to their school and say, hey, I want to bring this program to my school and show up before, during, or after school and let my kids run around and play. It's also a great opportunity for parents to hang out with their kids. It's turnkey and comprehensive. It's evidence-based. It focuses on holistic health. At the end of every lesson plan, we have an area where you can talk about nutrition, mental health, mindfulness, meditation, and it's empowerment. I mean, there's so many kids, whether it's high school or college, who are looking for volunteer opportunities, and there's so many retirees who are looking to get involved. This is a great opportunity. So that's it. I just want to show you, though, that's our board, but you know, what scares me the most is that we are going in the reverse direction. The World Health Organization continues to show an increase in physical inactivity. So right now, 24% of adults are inactive, but 82% of adolescents are. And so think about the US and how unhealthy our adult population is, and that's with 24% being inactive. It really scares me to listen to Gretchen and Adrian and the amount of kids on ADHD medication, especially high school and college students using them to study. And then you've got the social media addiction. So dopamine is, you know, at these levels that are so unnaturally inflated. So we really need to reverse that. And, you know, physical activity is a really free, easy way. And I just, you know, nobody pays for it because nobody makes money off of it. So, you know, it's unfortunate to listen to these, you know, companies that do promote the medications where I'm not saying medication's not always used or needed. It is sometimes, but I really wish that schools would start having daily play and physical activity, and we'd get back to the basics. So that, oh, and this is one other really alarming stat, is that our physical inactivity has become a national security risk. 71% of our young people in the United States are not able to join the military because they are not in shape. So that's a scary stat right there. I could go on and on, but I'm going to stop there because I'm going to let people ask questions.
Awesome. Thank you so much, Kathleen. That was great. And, you know, our group can't thank you enough as well for how you've aided us in this, you know, fight of advocacy and, you know, this discussion of how exercise improves brain function and focus. And to all of our panelists, you guys individually contribute so much, not only to us, but to the greater population, honestly. So this has been really a great productive sequence.